well, for a few months now, but the thing with her skin was that it was quite dry, she has eczema, so her skin, her facial skin was really very dry and just not healthy enough for me to do any peels on it. So the first thing we've had to do is address that, because then if I didn't address that, there's a danger that I'll make her dryness a lot worse. So she's been using products for quite a while, so we'd say about 2 months now. She's now found that her skin's feeling less dry, or not dry at all really, would you say?
Not dry at all, so I think it's the best my skin's felt like. It feels like a baby's bottom, so it feels quite plump, and my skin's never felt like that. So I've always had a lot of dry patches and always been quite like not smooth, and it's a lot plumper.
This time the peel stays on for a lot longer because it takes a lot longer for the effects to become apparent. Well, let's say a lot longer, but it just takes a little bit longer for the peel to get in. Put some Vaseline on her lips just to protect them. And the other bits. So I'm just putting a bit of Vaseline in the areas I want to protect. And last time when we did it, she had a little bit of whiteness just near her nose, so I'm just going to protect that area as well. And then I'm going to just apply the peel. So again, Sangeeta, if you just tell everyone what you feel, 0 to 10.
Don't really feel anything at the moment.
Okay. So this time, what I'll probably do is apply a lot more layers, as long as she doesn't say that the pain is getting any more than a 4 or a 5. Sangeeta, what are you feeling now?
Like a 2.
Excellent. So we're feeling that there's something happening, but nothing too dramatic. I'm just going to focus on the areas with the actual pigmentation. You're feeling that a bit more now?
3.5.
So not much at all, really. And the thing is, just because she's not feeling that much doesn't mean that it's not working. It is working, it's just that her skin is taking it a bit better than someone who might say that it's a 6 or 7 straight away. I wouldn't expect her to be saying it's a 6 or 7 quite yet anyway, because of the nature of the peel that it is. So under a 5?
Yeah, just under a 5.
Just under a 5.
4.5.
Okay.
Feels alright.
How many minutes is that, Chris?
That's 1 minute 39 so far.
Oh, well. Got quite a long time to go with this one. We leave on for about 10 minutes if the patient can take it. But I just keep applying the peel. So you can see it's quite different to going and having a facial done. This is not a facial at the end of the day. We do need to, as a clinician, I need to keep a really close eye that the skin is okay. And also, the difference between going to a medical professional and not going to a medical professional is the fact that if there was a complication, we would know how to deal with it. Her skin will be neutralised, so it can't do any further damage or any further, like the chemical can't work on the outer side of the skin. Okay, is that better? Yeah. I'm just going to put this on so that you don't feel. Again, if you close your eyes. Excellent.
If I've never had a chemical peel before, is there a governing body? So would I know that somebody is definitely really qualified as opposed to not being or having got their licence from a complex packet, etc.?
So the problem we have in the UK is that there is no regulation of this, the cosmetic industry at all, which is why lots of different professions can carry out these procedures. Most people would go on like a day's training course with the manufacturers that are doing them, and that would be enough for them. So that's with no medical training, not any knowledge of the skin or how, like I said, how to deal with the complications. So the problem we have in the UK, a massive problem, is that there's no regulation of the cosmetic industry at all. So anyone can inject you, anyone can do a peel, and like anybody can do the Botox. It's a prescribed drug, so you need to get someone to prescribe it. But once they prescribe it to whoever it is that's injecting it, they can go ahead and inject it. But when there's problems, then there's really no one to turn to. There's nobody if you go to a dentist or if you go to a doctor or if you go to a prescribing nurse, you have their governing body. So we are governed by the General Dental Council as a dentist. My husband will be governed by the General Medical Council, and the nurses will be governed by their nursing body. So you will have some sort of rights as a patient when you come to us. If you go to someone outside of those three professions, or pharmacies, some pharmacists also do these procedures, and they are also covered. But healthcare, if you go outside of the health, like the medically qualified professions, then you won't have anybody kind of protecting you. And actually, ironically, you have more rights when you buy a toothbrush than you do when you have something injected into your face, which is really quite amazing, yes. So we have, how's that feeling now?
That's good.
Not tingling? No. Brilliant. Okay. So there are little patches of whiteness like there were last time. And I'll put the cream on to see if we can just get rid of them. So again, I'm just going to put that post-laser cream on, which is just to help soothe the skin. And then the SPF.